One of the most vulnerable populations to suicide are the people who have signed up to fight for our lives and our freedom. Studies show the risk for veterans taking their own lives continues to climb year after year. But some veterans here in Colorado believe they have a way to help. New this morning, they're showing Jordan Chavez how.
The reason that I'm here and have a passion for mental health is because my former career field, explosive ordnance disposal, that's Army Bomb Squad, we have the highest suicide rate of any job in the military, hands down.
A number Sam Peterson could have easily been a part of after his own time serving our country in Afghanistan.
I kept seeing time after time people in our community, killing themselves.
But the death that hurt him the most was his own mentors.
Didn't tell anybody, didn't show any signs. He walked out into his backyard and shot himself with his 3-year-old son in the house. And it was, am I going to sit here and wait for someone else to solve this problem, or is it going to be my problem?
He wouldn't take it on alone. Sam teamed up with Dr. Ron Schwenkler and Dr. Eric French.
The brain fascinates me.
Also a veteran of the Army National Guard and psychiatrist.
We've all had an idea that mental health care has been practiced in ways that has too many holes in it, and it's disenfranchised, it's silos.
The latest data shows more than 6,200 veterans died by suicide, which is more than 52% higher than non-veterans.
We don't do nearly enough for them, and a lot of them feel, lost to the system.
Mainly because these are people who have chosen to serve a purpose higher than themselves.
That's a big part of their motivation behind Mind Spa, an outpatient psychiatry and psychology clinic in Greenwood Village.
We are focused on trying to make sure that we can get the brain tuned up, the pathways clear, and people operating with a whole brain wellness that is going to lead to a much more fulfilling life.
All this through integrative forms of therapy for the brain, like psychotherapy, medications if needed, ketamine, and transcranial magnetic stimulation, or TMS.
What we are trying to do is approach this complex organ with a complex solution. You wouldn't try to build a house with just a hammer.
Yeah, this is so great because Mind Spa has all of the therapies in one place because one therapy doesn't work for everyone. And I know specifically we're talking about veterans here, but this can help a lot of people.
Well, Corey, as you know, because you've just done a few stories yourself on all of this, they say that this could actually help anybody, but they say it specifically could really help first responders. They experience, of course, similar trauma in their own jobs as well. By the way, Mind Spa is accepting new patients. You can find them at mindspadenver.com if you're interested in checking them out. But I want to revisit that number we talked about. Again, the U.S. Department of Veteran Affairs says that suicide rate for veterans is more than 52% higher than non-veterans. And that same study shows that percentage has been increasing each year for decades now. And Corey, as we talked about, this is a really vulnerable population.
It really is. Like the doctor was saying there, we need to do better. 6,200 suicides in 2019 for veterans. That number is way too high, and we have to work to get that down.
Yeah, far too high. And one of the problems they say with this group of people, specifically for veterans and probably first responders as well, as you've done your research, is that they say mental health is really stigmatized among this group. They say they fear that if they show weakness or they talk about this, they won't let them around the tools that are needed in order for them to do their jobs.
Yeah, I just did a story on Heart Counseling where they kind of focus on law enforcement and first responders, right? And it's kind of a thing, like you go from one call to the next call and you're not processing the calls that you're on, and over time your bucket continues to fill, and at some point it becomes too much.
Right, and let's be clear here, that wouldn't hurt their jobs in any way. If anything, it would only help them do an even better job.
It's so true. Mind Spa, I love that they're doing this. This is a great story, Jordan. Thank you. For any of our veterans who need someone to talk to immediately, there is a veteran suicide prevention hotline that you can call right now. The National Veterans Crisis Line number is on your screen. It's 800-273-8255. Just press 1 when you call. You can also text the Veteran Crisis Line at 838-255, or you can chat with them online at veteranscrisisline.net. And then for everyone, if you're struggling and you need someone to talk to, Colorado Crisis Services is available 24/7. Their number's on your screen now, 844-493-8255. You can also text the word 38255.